So far, we've only seen the results Cosmo has published about Breezula in various press releases. But if you want to know how these results translate into real life, how that 539% improvement actually looks on 2 real patients, stick around because this video is for you. We're going to look at the actual clinical results of 2 patients who participated in the latest phase 3 trials for Breezula, Cosmo Pharmaceuticals' solution for treating alopecia. In this video, we won't dive deep into the science behind this new drug. Instead, we'll focus on the visible results experienced by 2 of the more than 1,400 patients analyzed in the SCALP 1 and SCALP 2 studies. Now, it's important to remember that Breezula recently broke the internet when Cosmo announced that in one of their studies, the target area hair count improvement exceeded 530% compared to the placebo group. So the question you're probably asking yourself right now is, how does this translate visually? Before we look at their 6-month progress, it's worth noting that both patients only used Breezula, the 5% Clascoterone topical solution, and did not use any other hair loss treatment. Without using anything, the hair condition would typically have worsened after 6 months. This is important because I'm tired of seeing people tell me that their finasteride treatment hasn't worked, when in reality, looking at their photos, it's obvious that it has. In most of these cases, they achieve a small amount of regrowth, but the key is that the alopecia has stopped progressing. This is crucial, because if these people ever want to get a hair transplant in the future, they can do so with guarantees since the treatment has successfully stabilized their hair loss. Here's the hair condition of the first patient. As you can see, this person had localized hair loss in the hairline and the crown area. Stage 3 with vertex in the Norwood-Hamilton scale. And here is this person's hair condition after 6 months of using 5% Breezula. As we can see, the change is highly noticeable. We can see how it has managed to increase hair thickness and density on the top of the head, and the improvement in the crown area is remarkable. Definitely a very positive evolution, although it's true that this person didn't see much improvement in the frontal area. That being said, you can notice how he managed to increase hair thickness in this area, although he doesn't seem to have successfully transformed a significant amount of miniaturized hairs into healthy terminal hairs. Now here's the second patient's hair condition before statin treatment. As we can see, this person had diffuse thinning affecting practically the entire top of the head and the crown. And this is his hair condition after 6 months. As you can see, the change is incredibly positive. He managed to increase hair density across the entire head. A truly amazing transformation considering this person only used Breezula for 6 months. In this case, this individual did achieve a visual improvement in the frontal area, though, as I mentioned, this patient improved his hair condition across all areas affected by alopecia: the frontal area, the mid-scalp, and the crown. Something that really stands out is how well Breezula worked for both of these patients, both on the top of the head and the crown area. Now that we've seen these 2 cases, what can we take away from all of this? If we look at these 2 cases and what the phase 3 data from Cosmo tells us, which analyzed more than 1,400 patients, we can see that this topical solution works on its own without adding anything else. However, when you look at its mechanism of action, that's when these results get even more interesting. Both Breezula and Quintor's plotamide work by decreasing our follicle sensitivity to DHT. This means combining them with finasteride or dutasteride could yield a synergistic effect. While Breezula reduces the follicle sensitivity to DHT, finasteride or dutasteride effectively reduce the amount of DHT reaching our follicles. This would make them the perfect couple. Obviously, the ideal scenario would be to have clinical trials comparing the efficacy of Breezula, KX826, also known as plotamide, and GT20029, so we could choose the most effective of the 3, or perhaps the one with the best quality to price ratio, assuming of course that their safety profiles are comparable. As an example, take this 2002 study that compared the efficacy of 1 mg of oral finasteride, 2% topical minoxidil, and 2% ketoconazole in patients with androgenic alopecia. It showed that while all treatments and combinations are effective, finasteride is the most effective drug on its own, and combining it with minoxidil or ketoconazole yields better results than using any of these treatments in isolation. Or take this other 2004 clinical trial, which demonstrated that although oral finasteride and topical minoxidil are both effective and safe for treating hair loss, finasteride remains the more effective drug of the two. What seems obvious at this point is that none of these new drugs are coming to replace finasteride or finasteride, but rather to complement them and help you get better results. That's why the new big three could easily be finasteride, minoxidil, and whichever of these new drugs gets approved first. If you are afraid of using finasteride or finasteride due to potential side effects, I have published the most comprehensive book on this topic that will answer any questions you may have and help you make an informed decision. I'll leave the link in the description. Hopefully, we will soon get the first clinical trials comparing the efficacy of Breezula, KX826, and GT20029 used alone and in combination with finasteride, so we can see if what seems like a clear synergy in theory translates into real life. This is really important because it's precisely thanks to a multitude of clinical trials comparing the efficacy of finasteride and minoxidil that we know the combination of both treatments yields a synergistic effect. For example, this 2025 systematic review and meta-analysis that included 7 clinical trials demonstrated that there is a synergy between topical finasteride and topical minoxidil. Furthermore, we have a multitude of clinical trials, such as the 2002 study we looked at earlier, or this other study from 2015, which proved a synergy when combining oral finasteride and topical minoxidil. By the way, if you'd like me to make a video comparing the drugs currently under research for hair loss and give you my honest opinion on which ones are the most interesting to add to your current regime, let me know in the comments. And if you want to know everything science has to say about Breezula, you have to watch this video.